Well, good morning. Welcome to Coffee and little Crumpets with Dr. Childress this morning. Today, I want to talk about the parents, the targeted parents. That's typically what you're referred to. Move a little bit closer here. So the targeted parents in this family court conflict. The what I want to convey today to the targeted parents is that this is spousal abuse. I know the focus a lot of times is on the child abuse and on the attachment pathology and all the court conflict and mental health people and all these sorts of things. But fundamentally, at its core, this pathology is spousal abuse. It is a brutal and savage spousal abuse of the targeted parent by the allied pathological parent using the child as the weapon. And that's just brutal. It's brutal to the child, it's brutal to the parent. And in weaponizing the child into the spousal conflict, the allied pathological parent creates such severe attachment pathology and thought disorder pathology in the child that it rises to the level of child psychological abuse. So that's the focus diagnosis that we're working with on this, is the child abuse diagnosis, in order to be able to protect the child and restore the child's healthy normal range development. The diagnosis for the child's pathology is it's a false attachment pathology, a factitious disorder, a shared persecutory delusion that creates this severe false attachment pathology in the child for secondary gain of manipulating the court's decisions around child custody and nullifying court authority because of the induced pathology. And so that's a DSM-5 diagnosis of a factitious disorder, false disorder, imposed on another, imposed on the child. That's 300.19. And child psychological abuse, V995.51. That's the diagnosis. Diagnosis guides treatment. But that's a secondary diagnosis relative to this pathology. The primary issue involved, the primary pathology, is spousal abuse, using the child as a weapon, psychological, emotional spousal abuse, and that's a DSM-5 diagnosis of V995.82, spouse or partner abuse psychological. Now, this pathology, this particular court-involved pathology, is a pathology of lies. It is a delusional disorder. Everything about it is a lie. The narcissistic, borderline dark personality lies considerably, pretty much all the time. Whatever they need to say, they say it. And one of the lies are so pervasive that no one quite sees the extent of them, but they're all over the place. And one of the fundamental lies is when you're told, this isn't about you, it's about the child. No, this is about you. This is all about you as the parent. The child is being used as a weapon of spousal abuse. So this is spousal abuse. This is all about you. But notice what that does. It takes away your ability to assert your pain or your trauma as a valid consideration in the family issues, in the family conflict. So, oh, it's about the child and your suffering and your pain. You're not really a person. That is incredibly manipulative. And so going forward, I just want to make you parents aware that I'm aware, and I will be bringing this issue of the spousal abuse prominently to the attention of my professional colleagues, because we are failing. Professional psychology is failing in our duty to protect on two independent counts. They're related, but still separate. One is we're failing to protect the child from psychological child abuse by a parent, the factitious disorder imposed on another. And we're failing to protect the spouse, the targeted parent, from a brutal and savage emotional and psychological abuse by the other pathological parent, using the child as the weapon. Now, there's a group of people, as we begin to go into the spousal abuse domain, that men will have a harder time in advancing the spousal abuse issue in the family courts with the pathology, because there's just sort of a cultural misperception that men cannot be abused as spouses. Well, yes, they can, and this is one particular way that it occurs. And there's developed a men's rights group that asserts that fathers are equal, that fathers are important in the role of in the lives of their children, and are co-equal to the mothers in that regard. And all of that's true. But within that men's rights movement or fathers' rights movement, there is another group who are pathological. I call them gender monkeys. They are men who use this pathology or use the issues to bash women, misogynistic kind of attacks on women. And they're often, like in internet groups and stuff, they're often trolls who inflame women who have been abused by this, by blaming all women, and use borderline a lot. Covert narcissism is a term they like to use. And those are, I call the gender monkeys. Their interest is in generating false divisions between men and women. And this pathology has two variants. One is the narcissistic variant, and that tends to be with a narcissistic father or husband, and that has a higher spousal abuse feel to it, to the targeted mother. And so what I'm talking about with the spousal abuse diagnosis will likely be more easily seen on that variant with the narcissistic dad, spouse, and the targeted mother. On the other variant, that's the borderline spectrum variant, and that's a targeted dad and a borderline spectrum mom. That has a higher anxiety feel to it, a lot of false allegations to that variant. But the gender distribution is pretty much 50-50 in my clinical experience. There's just two different variants of it. So over in the men's side of things, or over with the borderline spectrum, you have the men's rights movement or the father's rights movement kind of addressing that issue. They're more focused on false allegations of abuse, and they have an interior gender monkey component that is false, but it is an authentic issue that's over there. Then in the other side, the narcissistic variant with the targeted parent mothers, I suspect you'll have a stronger response to the spousal abuse issue when you raise it, that the dark triad personality over here has a narcissistic and psychopathic qualities that can become very abusive. Within that community, there is a group that I call the DV monkeys, the domestic violence monkeys. Those are women who falsely present domestic violence and that we need to protect the child from, the false allegation of domestic violence. They're actually over in the borderline spectrum of creating the pathology and seeing fears where none exist and false allegations, but they're inhabiting the true spousal abuse community. And there is truth to the spousal abuse community. I have worked child abuse foster care and with spousal abuse. I have personally arranged the safety plans that have gotten moms and their children into shelters. When I was clinical director, I had access to these shelters, and I went and saw my clients sometimes, or did a group one time for the moms and children that were in one of these hidden shelters for abuse moms. So I'm well familiar with intimate partner violence, IPV, what people call domestic violence. There's two types. There's terrorists and there's situational. And I'm well familiar with that community, and it is a valid community. We belong to that. This is spousal abuse. So if you run into any of the DV monkeys out there, join them. Say, absolutely, you're absolutely right. We need to protect children from spousal abuse or parents, the domestic violence kind of things, IPV. You're absolutely right. We need to do that. So we're part of that. This is spousal abuse using the child as the weapon. The pathology itself, as we go forward with this spousal abuse diagnosis, as well as a child abuse diagnosis and the shared delusional disorder that's created, the attachment pathology. The pathology itself does everything it possibly can to destabilize you in every way possible. And it has source code. I call it source code, but it's patterns within how it works to do exactly that. It isolates and separates the victim from support and rescue, and then it does everything possible to destabilize the victim so that it can alter reality, and the victim kind of collapses into the altered reality without being able to create any sort of change in it. And so it's created this false pathology in you, a false mindset in you that you are somehow a victim of this pathology, and that the pathological parent is all powerful and has all this control and all. Actually, that's not true. They are very fragile and very weak. They are not powerful at all. All the symptoms emerge because they are so fragile and weak that they cannot manage in actual reality. They need to do all this false stuff and manipulating the world and manipulating everybody. So while the presentation is very powerful and dynamic with them, no, they're not. But they trigger your fears and trigger your false beliefs that you are somehow inadequate or that they are powerful. And there's a discrepancy. And you begin to operate out of this false belief that, and what I want to talk about today is reestablishing your confidence as a parent, because it has triggered, the pathology has triggered you into your insecurities and fears. And we need to get your ground back under you. And so I want you to listen carefully to what I'm going to say here. You did nothing wrong, okay? There was no problem in anything that you did, okay? Bad people are doing bad things to you, and we're going to make them stop. Now, that's what we tell child abuse victims. That's what we tell spousal abuse victims on our first recovery of them. You did nothing wrong. It's not your fault. Bad people are doing bad things to you. We're going to make them stop. That's what I'm telling to you as a spousal abuse victim, because this pathology has you on the defensive. That's what it does. It attacks to put the target of the attack on the defensive. And as long as you're on the defensive, it's hidden. It can stay hidden because no one's focusing on the pathology. They're all focusing on you or the target. And so we need to reverse that around and get the light back onto the pathology so that we can see it and everybody can identify it. But that means we need to get you off the defensive. And you don't need to be on the defensive. You did nothing wrong. And so that's another lie. This is about the child. It's not about you. That's a lie. No, it's totally about you. And that you have to defend yourself and prove no, you don't. That's also a lie. You did nothing wrong. But what we need for you to do is to re-own your confidence as a parent and confidence in who you are, because that's where the pathogen is specifically attacking. And I can tell you how and why and the source code, the patterns that are doing that, but it's attacking your identity as a mother and a father. When we have children, we lose our former identity. We stop being John and Mary and we become mom and dad. And that's just our name for the next lifetime. We are mom and dad. And for human beings, Erik Erikson described a set of developmental stages we go through: basic trust, mistrust, initiative versus, inferiority, all these sorts of, bonding issues and identity issues going forward. In adulthood, the issue is generativity, which means our task, our developmental task as adults is to generate a life, to create a life. And typically that's in our career and in our family. So what are we doing in our career? Are we successful, or are we failing in to generate a life in terms of our career? And in our family, are we creating a family, or is that a problem? And what this pathology is attacking is the identity of a human being as mom and dad. Prior to the divorce, you parents, had an identity. You were mom and dad. As soon as the divorce happens, you're no longer spouse, but you're no longer a mother or father either. You don't have a child. And so your entire identity is lost. And then you become destabilized, you become fearful because of all the lies and all that, and you start to get all defensive and try to prove reality to people so that you can maintain your identity. It is a very destructive, complex pathology that has motivation. Okay, no other pathology has a motivation to create itself. ADHD is not trying to be ADHD. It's not trying to defend itself as a pathology. Autism is not trying to create autism and defend itself. This pathology it's a trauma pathology. So it creates the personality pathology of the parent that then needs to have this symptom expression in order to stabilize itself. So it's motivated to do certain things, to create certain patterns of symptoms in order to stabilize itself. And then it's motivated to defend itself against any sort of correction or treatment. So this pathology has triggered you into your fears and into your insecurities. We need to help you find your confidence again as a parent. And one of the aspects of finding that confidence is the challenge to your parental authority. So the child challenges you as a parent, challenge your authority when you tell them to do something. For younger children, it's more 4 or 5. It gets more of the high anxiety kind of feel to it, but that relaxes when they're with you a little bit. But for the older children, maybe 8, 9, 10 and above, it gets very angry and very rejecting, very challenging of your authority. And there's four emotions. If you talk to me ever and I do my thing, I'll tell you about the four emotions. But two of them are power emotions. That's dominance, which is angry, and submission, which is afraid. And then two are social emotions. That's happy, social bonding, and sad, draws nurture. What the child does, the parent, the pathological parent, downloads the challenges to your authority into the child. And so they challenge you over in the dominance region for alpha in the family. And you have basically two choices. You can reassert your alpha dominance, and that's angry, and now you're into a fight with the child. Don't talk to me this way. You're not allowed to do those sorts of things, and you're into a conflict with the child. Or you can go submissive to the child's dominance, and that's not good because then you have the child running everything. So you're kind of in a double bind. You will find those a lot with trauma pathology. So the pathologies put you in a double bind by challenging your authority, and then do you either fight with the child, and then that feeds the whole narrative, false narrative, that it's something about you and the child, and you're not compassionate for what the child's saying, and all these other false assertions. Or you can go submissive to the child, and the child rejects you, and you just have to put up with it on that. What I'm going to encourage you to do instead is to bring over happy as the background emotion, as the intent, the emotional organization that you have, instead of angry. And here's why. Happy is also a power emotion. In addition to being a social emotion, it's a power emotion. And the way that works is if I'm sitting around with a bunch of my monkey critter friends and we're all eating bananas and everybody's happy, I know there's no predator threat around. I know there's no danger. And so happy, that emotion of happy, communicates no threat or no danger. So when the child challenges you for dominance, if you respond from kind of a background state, oh my goodness, what's going on with this? And just a background state of happy, oh my goodness, do you feel that way? What's going on? You can respond to the child authentically and say everything you want to say, but emotionally you're communicating to the child that their alpha challenge of you is no threat to you. You're confident in your parenting. And that's the emotional communication that child needs in that chaotic, difficult situation where they're pathological. They got this pathology from the parent that's kind of inside them, this garbage, this toxic stuff, and they spew it onto you, and you respond that, no worries, I got it. Okay, I know what's going on, and I can figure my way out with this. And it's really easy to do that, to create that background state. It's just a smile. Because when you smile, you fool your brain. It's a little brain hack. You smile, you fool your brain into thinking you're happy, so it releases a little happy brain chemical. And whatever other feeling you're having, anxious, sad, or angry, it will add a little happy to that. And when you add happy to angry, you get leadership, because angry is power, assertion, and voice. So at the beginning of this talk today, I was in kind of a background state of angry. I'm not angry emotionally, but this is a power, assertion, and voice. Now, when I add happy to power, assertion, and voice, I get leadership, I get social bonding, and come on, we can do this. When for anxious, anxious turns everything on and and sad turns everything off. When we add happy to anxious, we get excitement. That's your roller coaster. Woohoo, this is so fun and exciting, but it's scary at the same time. When we add happy to sad, we double up on the social emotions. We get compassion. When do we feel happy and sad at the same time? Excuse me. When we're sitting with somebody we love and they're sad and we're sad with them, but it feels good to be sad with them. That's compassion. So we can add happy to anything. Just smile onto it. And it adds a little happy chemical. So that's what I'm going to suggest to parents, to begin to re-own some of your power on this, is to not get triggered into your fears, where you respond either from, oh my goodness, this is important, I have to do something. That's an anxious response. This is important. Oh my God, what's happening? Or from an angry response of, no, this has to, I have to solve this, and I'm asserting. So just add happy to either one of those. Okay. And you add the anxious, oh my gosh, this is so important. Not particularly. We're going to figure this out. The or I need to solve this. Well, we need to solve this. We can just move into leadership. When you assert, like I'm doing now, so you assert something, you're going to get pushback. That's called resistance. That's just how things work. You push one way, it's going to push back the other way. When you add happy to your assertion, then you're adding social bonding that draws the other person in. So now you can assert and say the same things, but you're asserting in a softer way that draws the person to you. And so just remember that little skill of just keeping a little happy dose of brain chemical in the back of your head to maintain that confidence and power and authority of a parent without getting locked into conflict with people. Each of those emotions has a lie associated with it. The lie of angry is, I don't care. Yes, you do. No, I don't. I don't care. You will when you're not angry. I don't care. That's the lie of angry. I don't care. The lie of sad is, it's always going to be this way. No, it's not. It's going to change. No, it's always going to be like this. Yeah, that's the lie of sad. The lie of anxious is, this is important. No, it isn't. Relax. Take it easy. No, really, this is really important. Relax. Take it easy. And so with adding the happy in there is just the relaxed, no worries. Everything's going to be okay. I got a handle on it. And when your child is in a dysregulated, disorganized, anxious, fearful state about everything going on, confused state, it's a very reassuring and comforting emotional response to get that the parent has things covered. Don't worry, I got this covered. Now you say, oh, my child says, don't laugh at me. And exactly, don't laugh at them. But you can just hear it in my voice right now. If I just keep a low level, I'm just, oh my goodness, what's going on for you? What's happening? As opposed to, oh my goodness, what's going on for you? Or knock that off, or this is important. Because that's what the pathology wants to trigger you into. It wants to trigger you into your fears and insecurities and your defensive posture and get you spinning. Now, in this regard, I will note my colleague Dorcy Pruter, who understands this well and has developed many approaches to helping stabilize parents through this. And she has a number of resources. So I would recommend that all parents get hooked into her community. She has a Facebook group. That's probably where I'd start, the Alliance to Solve Parental Alienation. Go there, hang out, hear her philosophy and her approach. And then she's also created a number of resources. And some are expensive and some are less so. I would recommend, all of them are effective. I would recommend that you take Higher Purpose Parenting. That's her online parenting course. She will teach you a set of skills in there that will keep you stabilized and will help you address the fears that get triggered, address them productively. But it's a skill-based program. If you don't work the skills, nothing's going to change. But if you work the skills that she teaches, it will be immensely helpful. And so that's my recommendation, is get over to Dorcy, Higher Purpose Parenting. She also trains coaches you might want to consider. And then she has some higher end resources as well. But she understands how the pathology is seeking to destabilize you. And part of her role and my role is to provide you with the support that you need to be able to stand on. So I'm providing you with that support out of professional psychology. I'm providing you with the professional knowledge that you need to affect the changes that need to happen in the mental health system around you. And then Dorcy is helping you work with some of that internal stuff, your own childhood traumas and stuff that kind of organize you to why did you pick this person and wind up here with this situation, and you're all into this situation. So so I'd suggest you get into her world to help you learn some skill sets and restabilize you as a parent, and then to become an informed consumer of mental health services. And that's an important piece for you parents. The pathology triggers you into your fears, and then you seek rescue. And so you say, and you seek to prove that the lies it's saying about you are not true. And there it offers you bait, the pathology does, of parental alienation. And if you hear that, you go, oh, that's exactly what it is parental alienation. And then you go down that road. And that road is into the court system, trying to prove a pathology to a judge, which is the most insane and difficult thing you can possibly do. You want to get this out to healthcare and diagnose the pathology. But notice how the pathology is manipulating you to get you into the courts by dangling up this non-existent pathology that, oh, parental alienation, and boop, you're into the court system trying to prove a pathology to a judge. Don't use parental alienation. Stay grounded in actual real knowledge. Factitious disorder imposed on another, shared persecutory delusion, child psychological abuse, spousal abuse, using the child as a weapon. The spousal abuse, going back to that diagnosis again, that they are the mental health people around you. It's a broken system, and that's what you're finding out there. You will not find any mental health people who can respond appropriately. That's the second aspect of what this pathology has manipulated. It's given you this parental alienation thing as bait, but it also created an entire field of psychology. They're called forensic psychologists. Back in the 1980s, the pathology makes itself so dangerous to us professionals that we took a risk management response of giving you your own special psychologist back in the 80s. They're called forensic psychologists. And then all the clinical people left. Okay, so there are no clinical psychologists around you. They're all forensic because your families are too dangerous to us professionally. I'm the only clinical psychologist over here, and I'm kind of setting the path for others to return. Okay, so it's not about Dr. Childress being an expert. Notice I use Bowlby, Minuch, and Beck. Knowledge belongs to everybody. It's that I'm setting a path. I'm the first one back. I'm a court-involved clinical psychologist. But the forensic psychologist, what the pathology has done is isolate you from support, isolate you from rescue, which is, again, its pattern. That's what it does. This is a sex abuse pathology rippling through families. And if you think about sex abuse, that's what it does. It isolates that child from resources and support and rescue. And then it can pathologize the child. And so what we need to do is get clinical psychology back. Forensic psychology is a failed model of service delivery to a vulnerable population. All they do is exploit you for your money. They solve nothing. And this becomes an issue surrounding the spousal abuse and child abuse, but spousal abuse by the forensic psychologists with their 6 to 9 month forensic custody evaluations. The differential diagnosis with this pathology is child abuse and spousal abuse. Those are both dangerous pathologies. And to delay your assessment for 6 to 9 months while you do all this nonsense and do not return a more timely assessment and diagnosis of potential spousal abuse and child abuse is contributing to both. It is participating in both. So during that 6 to 9 months of their forensic assessment, the child is typically in the custody of the abusive parent because of the pathology that's being manipulated and imposed on the child. So the child is being psychologically abused every day for 6 to 9 months, and it's being clearly communicated to the child that they have to submit to that parent because there is no rescue. That parent is all dominant and all powerful, and they get to induce the pathology for 6 to 9 months while these forensic psychologists dawdle. That is extraordinarily problematic for me. That's a negligent failure in their duty to protect, to conduct a risk assessment, a proper risk assessment for child abuse. And this needs to be understood. They are actively participating in the psychological and emotional abuse of the targeted parent, using the child as a weapon. And so we have a narcissistic, borderline dark personality parent who is weaponizing the child and using the child as a weapon of spousal abuse. And the 6 to 9 month delay in identifying that is 6 to 9 months of inducing of spousal abuse, of participating in the spousal abuse. Now, that's just the custody evaluation. You add all the mental health people on, we get years of these mental health people participating in the brutal and savage psychological and emotional spousal abuse of the targeted parent. Now, the targeted parents, you parents, are in a bit of a difficult position, that double bind about making that argument, because they'll say, it's not about you, it's about the child. They'll give you that nonsense. No, it's all about you. Spousal abuse is all about you. That's a lie. And if you try to make that argument, it'll probably result in backlash. The women, the mothers in this pathology probably have a stronger ability to make that argument. The men, just because of the biases in our culture, it may not be as recognized. But that is something I will be taking to my professional colleagues as a substantial failure in our duty to protect. Now, what's important to understand is that diagnoses are not proven. They are given. They are given based on a pattern match of diagnostic criteria to the symptom evidence. If the symptoms meet the diagnostic criteria patterns, you have that diagnosis. If you've got hallucinations, conceptual disorganizations, and delusions, you've got schizophrenia. That's your diagnosis. If you meet those symptoms, whether you like it or not, if you meet those symptoms, that's your diagnostic. That's your diagnosis. And so we got a shared persecutory delusion, factitious disorder imposed on another, child psychological abuse, and spousal abuse using the child as a weapon. And it is up to the mental health people. We have duty to protect obligations. We have two duties, duty of care and duty to protect. And we are failing substantially or they are failing in their duty to protect the child from child abuse and the spouse from spousal abuse. And a 6 to 9 month forensic custody evaluation is just that. Let me share a little bit more about opposing counsel. Opposing counsel, when they do things to delay getting a proper clinical assessment for possible child abuse, they are participating in the child abuse and spousal abuse. When they convince the court to do things that prevent or delay getting a proper risk assessment for possible spousal abuse and possible child abuse, they are getting the court to participate in the child abuse and spousal abuse. Attorneys are officers of the court. Now, I know their ethics are problematic, in the legal profession, and they have this zealous advocate role and a whole bunch of things like that. I understand that. At the same time, they are officers of the court, and when there is potential child abuse involved, they have obligations not to mislead the court or get the court to participate in the child abuse or spousal abuse for the benefit of their client who is the child abuser or spousal abuser. So the legal profession also needs to take a look at this issue. Over the past 40 years, because of the abject ignorance and incompetence in forensic psychology, that they are the pathology, they are participating in the pathology, they are financially exploiting parents and solving nothing. Because of that, they have not diagnosed the child abuse or spousal abuse, and they've left it vague as to what's going on. They haven't identified the pathology for the courts, and they have not treated it effectively. They've lulled the legal system into this slumber about the importance of the issue. And I'm a clinical psychologist, so I'm coming back and reanimating us as to exactly where we are and what the pathology is. This is abuse pathology. It's child abuse and spousal abuse. So as parents, as you reorganize yourself and re-own your confidence as a parent, you did nothing wrong, everything's okay, and your leadership. That's what Dorcy brings up when she calls you the chosen parent, your leadership of the family. That's what we need. And the mental health people need to come up and give you the support as the healthier parent. We need to give you the support that you need to lead this family successfully. Now, again, as I'm talking here, you can just hear that slight switch. When I added just a dose of happy, my voice softened and things got a little bit bitty. And so that's where you want to make the argument from, is this place of leadership, of confident leadership. There's no threat, there's no danger. You're the healthier parent. The other parent's pathological. And what they try to do is get you to defend yourself by all these false allegations. It doesn't matter how wild they are. They just matter that they keep the attention focused on you. And what you want to do is kind of brush those aside. You don't have to prove anything to anybody. And you stay on the attack, that it's two sides. It is a shared persecutory delusion. So now the mental health people have to do a proper assessment for whether it's whether you're abusive or whether the other parent is psychologically abusing the child. It's not up to you to prove it to them. Patients should never, ever, ever have to explain a pathology to the doctor. Holy Toledo, doctors should be explaining the pathology to the patient. But over here with your forensic people, you actually have to explain what the pathology is to them, because that's how absolutely ignorant and incompetent they are. So there is no standard of practice over here. 2.01, 2.04, 9.01. They just exempt themselves from all knowledge, from all ethical standards, from everything. They take your money for these big bloated 6 to 9 month forensic evaluations, $20,000, $40,000 that solve nothing. And then you have to come to me and pay me a bunch of money to analyze and tell you why they are so bad and get things back on a proper course. The mental health system is entirely broken over here. The forensic psychology is a failed model of service delivery to a vulnerable population. Clinical psychology needs to come back. The issue that you're going to face right now, you parents right now, is that the system is broken. You won't find the forensic psychologists to do a proper risk assessment because they're ignorant as sin. And the clinical psychologists, you won't find them either because they haven't worked over here, and they would be outside the boundaries of their competence coming back into the courts. So what's basically going to happen, as I foresee it, is the whole system's going to collapse. You're not going to be able to find, parents in the courts aren't going to be able to find mental health people who diagnose, except those who come back and diagnose the child abuse and spousal abuse and do the right thing. So we will maybe have a few that remain here, but they'll probably listen to Dr. Childress because I know what I'm talking about. And those that will remain know what the pathology is and will give you an accurate diagnosis, and then we will reorganize the mental health system by bringing back clinical psychology. Yeah. So I talk about Stahl and Simon and the origins of forensic psychology, and I'd love to debate the role of forensic versus clinical psychology. In chapter 2, they tell us why clinical psychology needs to go away and forensic psychology needs to be here to solve. No, forensic psychology is a failed model, 40 years, no solution. They are a failed model of service delivery. I will take the position that they made straw man arguments here, that they were false arguments, and that clinical psychology is not like they describe, and we need to come back, and that this was a failed risk management response to give any people, any population, their own special psychologists who do not diagnose or treat the pathology they work with. That was a bad decision, but we're getting out of it. I am working my system, working with my people, my approach to helping them find their motivation to protect the child and protect the parent in this situation, and to apply the established scientific and professional knowledge of the discipline to their professional judgments. You as parents, I'm encouraging you to orient to where you are. Do not trust the mental health people around you. You have to be an informed consumer of mental health services. Do not activate into your fears of this is important and go running around with your heads cut off. Do not activate into your assertion of I need to get this and I need to have it and I need to prove this to you. Relax. Take it easy. Take it easy. You're a good and capable parent. Take a deep breath. There you go. You did nothing wrong. It's not your fault. That's bad people are doing bad things to you, and we're going to make them stop. You're in a difficult situation right now because of 40 years of neglect from professional psychology, from clinical psychology. My clinical people have neglected you and abandoned you, and that's wrong. We don't abandon spouses to spousal abuse or children to child abuse, but we have. And there needs to be a self-reflective conversation within professional psychology about our duty to protect obligations, about ethical standards, and about a forensic versus a clinical model. This is not about child custody. I told you everything about this is a lie. It says it's about child custody. No, it's not. Child custody is easy peasy. That's like basically two approaches. Shared 50-50 or every other weekend, a night during the week. This isn't custody. This is pathology. The child's a severe attachment pathology, and it's either being caused by the targeted parent, that's child abuse, or by the allied parent, that's child abuse as well. So we need to do a proper risk assessment for possible child abuse, and from us, from the mental health people, a proper risk assessment for possible spousal abuse using the child as a weapon. It's not up to the spouse, the abused spouse, to convince us they're being abused. We're the mental health people. It's up to us to recognize the abuse and then take the appropriate steps to protect the patient, to protect the parent and protect the child. And we're failing massively, miserably failing in our duty to protect obligations. And it's negligent. So Google negligence, failure to take proper care in doing something. Google negligence law and get the Cornell definition of negligence. A failure of a duty a failure in their duty to protect. And they should automatically, the case comes in from the courts around child attachment pathology, they should automatically be doing a risk assessment, and that the turnaround on that should be 4 to 6 weeks. If we got an abuse pathology, we need to know what's going on in about 4 to 6 weeks. And if they don't know how to do that, then go away, because that's what we need. And we need to get psychologists over here that can do that. The couple of things, I have a couple more minutes left before I head off today. I want to talk a bit about online presence for parents, and what can you do to recover your child specifically. Now, to recover your child, I'd get over to Dorcy and listen to what she talks about. She'll give you a lot of good advice on recovering your child. But in the internet, this online world, recognize that everything you post to the public internet is public. So your child can see it, your child's friends can see it, your child's enemies can see it, the other pathological parent can see it, and I guarantee you everything you say will be used against you in a court of law. And the more accurate you are in saying something, the more it's going to activate the pathological parent, and the more they will try to use it against you. See what they posted on Facebook. See what they posted here and there, that I'm a bad parent and they're denigrating me online and stuff. So be very aware of what you post online, that your child is reading it. Do not try to recover your child online. Listen to this, because this is important. We cannot ask the child to reveal their authenticity until we can first protect the child. We must first be able to protect the child from the sure retaliation that's going to come if they reveal their authenticity. And so that becomes our primary focus, is protecting the child. What do we do in the meantime? We lead with confidence that we're going to navigate this out, and the child is confused. But that's our job, to work out. The challenge, as Dorcy would say, the challenge for the child that they're presenting to you is, how can I love both parents? They're being put in a position where they have to choose a parent, and they're giving you that problem, saying, Mom, Dad, how do I solve this? How can I love both parents in this situation? Here, let me give you the problem, because I know you can solve it. And so just say, okay, got it. I'm working on it. We'll solve it. And then we'll get to work on it. It's going to be through the mental health people. And that's where you're in a false world, when you're having to prove a pathology to a doctor or to a judge, but you have to explain and prove a pathology to a doctor. You're in a false world. The doctor should be telling you, when you're trying to recover your child from a delusional thought disorder and child abuse and spousal abuse, and you're trying to get out of the spousal abuse yourself, the mental health people should be there for you. That's not your job. That's their job. That's why we get trained as psychologists, people, is to recognize spousal abuse and child abuse and delusional disorders so we can protect people. That's our job, not your job. But because we're failing in our job, you're having to do stuff you shouldn't have to do. So recognize that. And don't try to do too much. Let's get you some mental health people in here who can get you the diagnosis. And we'll see what we can do about that. I'm available for consultation, but the systems are broken around you right now. And that's the other thing to recognize. The systems are broken. The forensic psychologists are bad people. They're not going to help you. Reunification therapy, there's no such thing. It's not going to help you. You want clinical psychologists. We want to get them back. Dialectic behavior therapy is the people we want back, because they're trauma informed. And the structure of that pathology, or a structure of that approach, it's based in behavioral psychology. We'll get an applied behavioral analysis knowledge with them. And they are familiar with the borderline pathology, and narcissistic is very close. And so they're tough enough and strong enough to be able to handle the personality pathology. What they won't know is all this court stuff. Okay, so they will be tremendously um, uncomfortable coming into the courts because it's so dangerous. But the DBT therapists work with suicidality and borderline patients, and so suicidality is a dangerous pathology to work with. And so they're not afraid of danger. They just need to kind of get oriented to where we are with the courts and that a factitious disorder. The diagnosis always guides treatment. Factitious disorder, shared persecutory delusion associated with the collapse of a narcissistic borderline dark personality pathology. As soon as they kind of get that diagnostic understanding, they'll be able to adapt and get in here. But it's up to the mental health people to solve it, not you. So be careful about trying to recover your child right now if you can't protect them. The other feature is in the recovery of the child, it's not by helping them understand what's going on. No, you don't want to come through their thinking, you don't want to come through their self-awareness. That I know that seems like the only approach you have. That's not the approach. Okay. The approach is for you to be more confident in who you are. And I describe it a little bit in terms of music, that we have the pathological parent creating a Sousa march, and the kid, da, 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 and the Sousa marches are fabulous. I mean, everybody starts to march to one of those. It's just a marching tune. And so, mom's a bad parent, she doesn't deserve a child. Mom's a bad parent, she doesn't deserve a child. I'm a good parent, I deserve a child. And everybody's doing the Sousa march over here. We need to get you doing waltzes. We need to get you over here playing Mozart and doing dances so that your child will start to dance with you rather than march with the pathological parent. But the pathological parent has everybody doing that Sousa march. So how do we get you playing Mozart? Dorcy, higher purpose parenting will help. That just going into this state, okay? So you're confident in who you are. You didn't do anything wrong. Oh, here's my clock. So you didn't do anything wrong, okay? And you're going to lead this family out of things. You need support. That's the biggest thing, because the pathology is trying to destabilize you in every way possible. And so that's what I'm providing, sort of a reality check. And Dorcy provides, is that support that you need to kind of get grounded on and then activate. We're going to need to change how the mental health system responds. This is child abuse, and this is spousal abuse, using a child as a weapon. And we're going to have to help them understand their obligations, the mental health people. I'm available to do all sorts of consultation and with the mental health people, with your attorneys, whoever, to try to get a proper risk assessment and get the child protected. Either way, if you, as the targeted rejected parent, are abusing your child, creating the attachment breach with your child, a two-person attribution of causality, you're an abusive parent. The solution is identify what you're doing that's abusive, put it on a treatment plan, fix it, and then restore the child's attachment bond to you. That's the treatment for it. So if that's the case, let's do that. If you're not abusive, a parent-child relationship rating scale, have them document where you are. If you're not an abusive range parent, then it's a shared persecutory delusion created by narcissistic borderline dark personality for secondary gain of manipulating the courts. A false attachment pathology imposed on the child, factitious disorder imposed on another, child psychological abuse. In which case, we protect the child, restore the child's normal and healthy range development, then reintroduce the abusive parent to the child with enough safeguards in place to make sure the abuse does not resume when we reintroduce the abusive parent. That's what we do on that side. Either way, we protect the child. Either way, it's likely a child abuse diagnosis. We just have to figure out which parent. Final thing on just parents about proving pathology and things. One of the things I hear a lot is that two things. One is videotaping the child, trying to document the child's symptoms or document the false stories, or stop videotaping the child. That's a symptom feature of mental health failure. You don't have to, you don't have to videotape and prove the pathology to a competent doctor. Just, I'll collect the symptoms, I'll put the symptoms pattern match, and I'll give you a diagnosis as to whether you're a problem, and if so, what, and or whether the other parent's a problem, if so, what. That's my job as a doctor. It's proving pathology has to do with in the court system and proving you deserve to have a child and proving. No, you don't need to do that. So stop videotaping the children. That's not going to be helpful, and it's just used against you. The other thing is sometimes I hear parents taking off the doors of their kids' rooms, and then that's used against them. But you'd be surprised how common it is, like 20%, 10 to 20% of the cases. One of the reports is a parent took the child door off because the child's locking themselves in the bathroom, or the child's locking themselves in the room or something, and it's a discipline kind of strategy. Well, I'm taking your door off. That might be acceptable in like a normal range family conflict situation, oppositional defiant disorder or something. Not with this pathology, because then the pathological parent and child just make that all sorts of creepy innuendos about sex abuse. And it's like, what? Where does that creepy innuendo of sex abuse? Oh, this is a rippling sex abuse pathology and stuff. So stop taking your kids' doors off. Stop videotaping your kids. Don't look to the internet to convince your kids about anything. At some point, I'll probably come up with something you can do about posting on the internet, but it'd be more posting about your experience in your life. I'll wrap up with this, that abuse pathology, child abuse, spousal abuse, but child abuse pathology is the absence of parental empathy. It's a failure of parental empathy that causes the abuse and is a product of the abuse. That the two are the same thing. They're just flip sides of the same coin. Child abuse and failure of parental empathy are the same thing. And so just living with a narcissistic parent is the absence of empathy and capacity for cruelty. And so that is traumatic just in and of itself, living with a narcissistic personality because of the absence of empathy. And so that's the trauma pathology that your children are in, the complex trauma that they're experiencing, is the absence of empathy. And so the treatment for that is abundant empathy. And so that's what we want to be getting to the child, abundant empathy for their world from their perspective. Anytime you are asking the child to understand your world, empathy is going in the wrong direction. So abundant empathy to the child, and then let's activate the mental health system to do their job. And then once we solve this, once we solve the broken system part of this, then we will solve the pathology for all children everywhere, because it's the broken system that's the problem. It's not the individual pathology. We absolutely know what it is. We absolutely know how to solve it. We just need to do it. And we're not in mental health, and that's not your problem. It's not your fault. You did nothing wrong. Bad people are doing bad things, the psychologists included, and we're going to make them stop. So with that, I'm going to head off to my world on a Sunday, and we'll see you next Sunday for coffee. Take care. Bye-bye.